So now let's move to our next section of class, that is the mental status examination. So first, to know what is the mental status examination. This is the basic assessment that we do in psychiatry to assess a person and then evaluate. Like what you do clinically, patient comes with pain abdomen, that is the complaint the person is saying. So you would be saying I have a left or right hypochondrial pain or something. So that is the symptom of pain that person has come. So now you will clinically examine the person to elicit some signs. So basically MSc is the same thing what they clinically in medicine or surgery will be having. The same for a psychiatric evaluation, to evaluate those symptoms and to identify the signs is the process that is done by mental status examination. So it is the examination which includes various parameters. So in this we see first heading is the general appearance and behavior of the person. Second, we assess the psychomotor activity of a person, speech of the person, mood, affect of the person, thoughts. The thought is further divided into the form, the thought content and possession of the thought. Then we assess about any perceptual abnormalities or disturbance that is there in the person, and the cognitive functions, the judgment, and at the last, insight. So going on one by one, subsequently we'll see. First, let's in the mental status examination, briefly known as MSc. So first is your general appearance and behavior. This is basically describes the person in words. So it is that descriptive that once it is narrated, you can imagine a person. Say a person with schizophrenia or chronic mental illnesses, like some of the patients, a person you might have seen roadside, like even during the winters, they would not be wearing any shirt, or during extreme summer when it is 47 degree or 48 degrees, still they would be carrying blankets over them, shabbily groomed, overgrown hair, unshaved hair, and wearing dirty torn clothes, foul smelling. So when you describe such picture, so since I'm describing, you might be able to visualize a person with such a description. So that is basically the gist of GAB, the general appearance and behavior. So in under various parameters we describe the person so that it can be imagined what you are describing a person to be. So after history and clinical examination, we move to mental status examination. The first heading here is your GAB, general appearance and behavior. In this, first we describe about the build of a person, average build, underbuild, heavily built. Okay. So what is the build of a person? It's very muscular, very thin, so that can be seen, which is described. So it could be a muscular person or average build, you can say, which is like normal. Okay. Second is can be asthenic build. Asthenic build. These are thin build and chubby people, that is like seen in case of schizophrenia. And another is your picnic built patients. That description, these are very chubby, fat kind of people. So these are usually seen in mood disorder or bipolar disorders. Second, in the appearance, you will describe about what is the wearing, the dressing of the person. So dressing. So when you say an average built or heavily built or a thin picnic built adult male, female entered the room wearing or clothes that you can describe clean, tidy, untidy. So the way he is like, he is kempt, tidy, or unkempt or untidy, you can say. And there you describe about the dressing of the person. So appropriately dressed, like we are sitting, we are dressed appropriately, and when you go to a class, appropriately when you dress up, wearing shirt, pants, kurta, pants, etc. So that is required to the social setting, that is done. But the same when you go to a party, you will be wearing dresses or you will be wearing suits or sneakers, etc. That is appropriate to the social situation, say when you party. So that is appropriate to that place. While if you wear a dress, very shining, high heels, and you come to hospital for seeing patient, So that socially is not desirable in such culture. So that would appear inappropriate to that context. Similarly, like the example I was giving, when it is bitterly cold, chilly